Hello, my name is Rochelle Prosser. I'm a registered nurse, a certified legal nurse consultant, and a founding member for CancerX Moonshot. As a CEO and founder of Orchid Healthcare Solutions, my journey is both personal and professional. In addition to my 30 years of nursing, caregiving, and data science expertise, I spent 15 years navigating two immediate family members, including my daughter, through harrowing cancer journeys. I was shocked at the difficulties that caregivers face. After my daughter was permanently in remission, I thought, if this was so hard for someone who works in the healthcare system, then what are other parents from underserved and marginalized communities experiencing? As a nurse, this led me to act and find a solution. I have found three specific barriers in oncology: lack of knowledge, access to therapeutics, and healthcare system navigation. The first issue I addressed was the lack of knowledge that prevents populations from being aware of the full spectrum of treatment options. Having equitable access to oncological therapeutics can be just as challenging as the treatments themselves. First, I built the Prosser Cancer Treatment Library, which houses all oncological treatments in one place. It is designed to be an invaluable asset to any healthcare provider or patient, or when treatment has failed. While we are currently in product development and commercialization, we will expand therapeutic treatments for patients and providers who want more options, especially those from communities of color and vulnerable populations. Our second area is access to therapeutics. This can be impacted by your proximity to highly skilled healthcare providers and/or your ability to pay for services to remove financial toxicity. Access is also related to your awareness of who provides the ability to pay for care, transportation, and therapeutics. Patients in late-stage cancer often have exhausted their treatment options in their local community settings and will require innovation in their approach to care. We know 51% of people who survive cancer have medical debt and can avoid this debt by asking the right questions at the right time. Healthcare system navigation as the third barrier can be hard for anyone. It is especially hard and challenging in oncology and terminal illness due to the complexity of care and allostatic load. This can include insurance, prior authorizations, referrals, care coordination, provider availability, and clinical trial inclusion/exclusion criteria. Our role is simple: guided inquiry and resources. Nurses are uniquely positioned to provide these services, as we have already been doing this for chronic disease management care for over a decade. We created a program that honors the guidelines and standards of CancerX Moonshot. Under the new administration and mandates of CancerX Moonshot, additional CPT codes were released for oncology care navigation services and allowed additional clarifications of licensed professionals and non-licensed roles in oncology care navigations within the oncology standards of professional practice. There is no one-size-fits-all here. Our healthcare system navigation is delivered by our wonderful team of nurses, nurse leaders, social workers, and medical assistants. While we continue to develop our solutions to the three barriers in oncology into a dynamic platform, we are at a stage where we can and we must help patients now. And that's why the Orchid Care Navigation Program exists. Using reports from the Taylor Prosser Cancer Treatment Library, patients are enrolled into the Orchid Care Navigation Program. Spanning 12 weeks and at a low cost, we help patients often in late-stage cancer diagnosis whose treatment has failed to be effective for them, or they feel or are told they are out of options. Using the Taylor-Prosser Cancer Treatment Library, we can likely supply their physician with more therapeutic options, possibilities, and help patients and their caregivers navigate the healthcare system. Because in the last year of terminal cancer alone, most people spend around $150,000. In parallel to the Orchid Healthcare Solutions navigation program, we are developing the Taylor-Prosser Cancer Treatment Library platform, a HIPAA-compliant, seamless oncological continuum of care that our healthcare system has never realized, a portal to oncological care that our nation desperately deserves, that my daughter, my husband, my father-in-law, and my grandparents also deserved. Let me introduce you to the Taylor-Prosser Cancer Treatment Library platform. First, we start with the Taylor-Prosser Cancer Treatment Library. We have a nurse, doctor, provider dashboard that we use to facilitate all of our meetings with our patients, record and embed the sessions, and perform patient onboarding. Before anyone uses this system, they are trained to complete patient intake, how to speak to and with patients, and how to be an empathetic listener, mitigate and prevent bias in healthcare interactions, and understand how disparities and social determinants of health impact care delivery in rural, poor, urban, and marginalized minoritized patient populations. To use this, a patient must be referred to us. Let's walk through a patient journey. Imagine it's 9:59 a.m. We don't have a lot of information about this patient because they're brand new. As we begin the onboarding process, we start the call and they will join after a brief delay. Then we start the patient onboarding. First, we capture all the patient demographic information, including age, gender, height, weight. Then we capture location. We identify whether or not they have children, if they would like to have any or more children, and if they also developed a fertility plan. Lastly, we obtain oncology treatment history. We then identify the history of their cancers as we click in and select cancer diagnoses. Once selected, we have the option to add additional diagnoses if warranted. Then we can select the subtype, class, stage, grade, and if it's metastatic. Next, genetic information, markers, and biomarkers that may be present are captured. We enter when they were first diagnosed, if their cancer has relapsed, or if they have an additional cancer. We will then identify their primary care physician and their oncologist, in addition to facilities where they currently may be undergoing treatment and proximity to a hospital. By synthesizing all this information, we can identify treatments or cross-reactivity that can be and should be avoided to prevent patient injury and use the data in the Taylor-Prosser Cancer Treatment Library platform to produce treatments and recommendations. When I hit continue, we receive geolocation readouts for the therapeutics available for that specified cancer. We create a report and generate a therapeutic list that is given to the patient, caregiver, or provider. That list is also forwarded via secured email link to both the patient and the physician to facilitate intuitive communication about potential treatment options. So now we're going to exit onboarding, and Eleanor has now become an active patient instead of a new patient. On the nursing dashboard, we view a list of patients that are related to the study. You can see new patients, active and inactive patients. Each patient has a risk score, and if that threshold is surpassed, we receive an alert, shown here. Nurses know that there may be a need for intervention for this particular patient. We can ask the question, what does it look like when a patient has come back and they've had one or multiple appointments, like the 6 appointments shown here with Irene? The data is coalesced here, and from this we can start to develop the quality risk score or have improvement measures and report quality of life. Because we're sending them a survey. That survey is measuring quality of life in the 6 categories seen here. As we exit the nursing dashboard demonstration, now we average and aggregate the quality of life metrics. We can look at any patient's responses from the beginning of the study through each follow-up appointment. We then have a metric measurable out of 100% based on their self-reported quality of life relative to their baseline. For example, in this case, the numeric metric is fairly low. It is 35% out of 100. The hope is that as the study progresses, that quality of life metric rises. We are looking at the dural metadata of the appointment that occurred on November 4th. That was 35 minutes in length. Since the previous appointment, the average quality of life indicator has increased 8%. This means that we would not make any changes to their treatment outreach or treatment plan. Here, we can also see notes and attachments that might be useful for a nurse or physician, in addition to that quality of life category movement. Interestingly, every week, these categories will remain the same. However, the statements or questions related from 1 to 7 would differ to promote patient engagement. As a caregiver, healthcare professional, data scientist, and business owner, I know intimately that to navigate oncology requires distinct healthcare system understanding, effective provider-patient communication, and how to find and navigate solutions when all else has failed. It is a journey not to be undertaken alone. Therefore, Orchid Healthcare has secured committed partners to public and private ventures and are moving towards full partnerships so we can provide the best practices in stress management, urban and rural populations, and cloud-based healthcare, and be more than the sum of our parts. Cancer is an equal opportunity offender who doesn't care about who you love, your financial situation, or your political party affiliation. And we will not stop building oncological access until everyone, regardless of station, age, or stage, has an equitable solution. If you like what you see, we are looking for funding, partners, collaborators, and whatever you can do to move this movement forward, because it's bigger than all of us, and it will take all of us together. Thank you for your time. I'm Rochelle Prosser, CEO of Orchid Healthcare Solutions.